I'm Jasmine Varg. Thanks so much, everybody, for being here. It's really nice. I'm very happy to be here. I would like to introduce the solution a little bit. I write a lot about it, and I work with the patients here about it. I work in individual sessions in my office on this stuff. I want to just say it in a nutshell with a quote that I heard when I was in rehab, which was 15 years ago, and I've been clean and sober also in the program, since then. And there was a better than you, and I want you dead. Now, if you don't relate to that statement, you're not an addict. If you think, yeah, then you're an addict, either in your disease or not. And then there's another quote that is, I'm drinking so that I can forget that I'm drinking. Mm-hmm. And then there's also the subtitle of my book, it's How to Have Feelings and Stay Sober at the Same Time. Mm-hmm. Non-alcoholics find this a really weird statement, like odd, awkward, and they say, just don't relate. And so I have to tell you, we work here with very highly educated people, all on a master's and PhD level, and they're very good clinicians, and they can be very helpful to patients. There's always a tiny little part where a person that is not themselves in recovery can't relate. And that tiny little part is not really so tiny as Eric just described from a neurological level. And from a psychological level, what we all learned in what people with my profession learned in school is we learned from Freud about eros and thanatos. Mm-hmm. And eros is that part in the psyche that is pro-life, pro-survival, love, sex, creation, going forward. And thanatos is aggression, anger, destruction, self-destruction. So these are these two sides that we all have within. And the thanatos side is very important for survival because this is what makes you want to fight the predator or run, but all the stuff that was just explained on a neurological level. So you have thanatos and eros, and I'm going to tell you, and this is my personal take on it. Mm-hmm. I believe that as addicts, our thanatos side is just stronger. Mm-hmm. It's just more powerful, more developed. And the reason is usually genetic predisposition, like we heard, and also early childhood trauma. But the fact remains that whether you understand it from the dopamine level, where the dopamine, I just really brief, I don't want to get into it because he's much better at it than I am, but I just want to say that on the dopamine level, when you reward the whole essence of the dopamine system is to reward us for behavior that promotes survival, and it gets compromised and hijacked. So now the behavior promotes drug-seeking behavior. The addict, if you tell an addict you're gonna die, they say, really? Mm-hmm. So, an addict is not going to care about that. If such an addict speaks with a therapist who is not really, who comes from their own place where they would be afraid of death because they're more normal, they are going to miss that. It's a very important piece to understand. An addict, if you threaten an addict with prison or death, the addict is going to immediately want to get some more dope. That's the result. It's not that the addict says, oh, feeling? I don't know what to do. Please bring it on. Yeah. So there's like a different take on life. And with addiction, what we mean is all kinds of compulsive behaviors in that area. Whether it's alcohol, other substances, powder, liquid, or the mode of administration, this or that, it doesn't matter. Then there are the process addictions, where it's food, sex and love, gambling, shopping, all this stuff. And all of that is also translated neurologically. So it becomes very similar. And even the cutting is similar in that sense because really, I mean, if you want to be cynical, cutting is a cheap high. You know, you cut yourself and the body releases endorphins. So that would like reinforce such behaviors also. So if you, for the treatment, what we need to do is we need to counteract that by giving hope and motivation and very direct guidance. So we're like a reparenting type guidance to where people want to like follow you. Like in AA, there's a sponsor, and then the sponsor has a sponsor. It's like we're like ducklings following a new parent now. It's a reparenting experience where we are taught a whole detailed array of behaviors to chill. Really, people like me, we don't seek to expand our consciousness. We don't. We want to reduce it. Normal people want to expand it. Not me. If I see that movie Gravity, I'm thinking, I'm not going there. It's going to be disquieting. I don't seek such things. I seek comedies, and for me, everything is like a drug. I gauge everything by its entertainment factor. I'm not going to read a book unless it's entertaining to me. And the way I wrote my book is for people like me, which is why people like it. Brief and light and not too detailed, and the letters big, not white on the page, all that kind of stuff. Non-addicts usually don't look at it that way. They look at it more either intellectually or with their interest. But for people like us, it's all about feeling good, because we really don't. Because we're constantly disquieted and startled and thinking, like if somebody looks at us the wrong way, we can feel like uncomfortable. And there is this whether it's hypervigilance or it can be like a hypersensitivity. So the stuff that we lately do most, aside from, of course, the 12-step program, which I'm a great fan and I go a member, but is the mindfulness approach. And the mindfulness approach is kind of the opposite of what really we habitually do. As an addict, habitually, I want to immediately erase any negative feeling, and I want to be always excited and happy. Normal people, they're fine when it's not that way. But for me, in order for me to want to stay sober, because remember, I still don't care about dying, is for me to create like a friendly, gentle, internal climate. And I have to recreate that on a daily basis. Because I wake up with untreated alcoholism. I know it sounds pathetic, but that's just the truth. The truth is, I wake up and I'm not smiling. And I need to have a set of tools that stabilize me, that create an emotional stabilization every day. And sometimes more than once per day. Now, because I've been clean and sober for almost 15 years, I'm like 10 times, 100 times better than I was. I'm like fairly stable, I'm not so impulsive, I'm not so easily disquieted, all that stuff. But I am utilizing these tools, and I can't really like describe all of that in detail to you. I have, because I write, I have it in writing. I made 10 copies of some of those things. So if people are interested, please look at this or take some. The main thing that we do these days is what we call mindfulness. It's a fashion word. It's not really exactly all that new, but these days we call it mindfulness. And the main aspect of the mindfulness approach is what's called somatic experiencing, which is really that I don't act out impulsively, but instead I don't act out. And so how do I do that? By just focusing on the feeling. Rather than trying to erase it immediately, I just sit and I breathe and I identify where it is, where it's located in my body, and I breathe into it, and I do some breathing exercises, and I just sit with it. Maybe I write about it afterwards, and I can notice with this technique. It doesn't take a long time or anything, but I can notice that as I don't try to erase it habitually, it kind of fades. And maybe if I try to give it like a rating number from 1 to 10, and I think, oh my God, I'm feeling so angry or so upset right now, and I want to give it a rate like on a pain scale number 1 to 10, I notice, maybe a 3. And just by me like observing it and noticing it, and allowing it to be here, giving it a space and experiencing it, I somehow, there is a process where I don't identify with it anymore, where I become the observer, and where I remember I'm the one sitting here breathing. So it's not anymore that overwhelming feeling, but I am sitting here having a feeling that's really not like bad pain. And as I'm really like noticing it and breathing, the paradoxical thing that happens, it's a little bit counterintuitive, is that it reduces itself until it becomes almost a little bit boring, to where I think, okay, I'm good now. That's all the mindfulness is. It's really very simple. And of course, if I only do this when I'm upset, then it's not such a fantastically easy thing to do. The idea is to do stuff every morning, because for me, from the moment that I wake up until I maybe get to an AA meeting, I need tools to bridge that gap. Maybe not now anymore. I'm not that person anymore, because I have now established other habits. I have established other highways in my brain for 15 years. I am not that person. But in the first year, I would have needed like a whole toolbox. And I put that together by myself. I was not offered this, and in AA they don't really address the emotional dysregulation so much. They just don't. So what I learned to do was prayer and breathing exercises and meditation and the mindfulness technique that I just described, and some visual imagery, writing, reading, sharing, calling a sponsor, calling a newcomer, taking a walk, going swimming, going to the beach, and it's said AA calls it's a program of action, and it's something that will grow on you. But I have to tell you, people that are new in recovery genuinely do not care about any such activity, because their brain does not produce the dopamine. So they really don't care whether the sky's blue. I remember I used to drive people in the beginning, and I would say, look the sky, look the water. They would look. Okay, Dad, I got it. Like when you're newly sober, you don't care. And I think this is what's missed most of the time. And then, of course, the work on the trauma. And this is why people don't stay sober. Because they don't get, they are not offered the tools, and they are not offered the psychotherapy for the trauma. That's the reason. Mm-hmm. People can stay sober in AA if they are dealing with alcoholism only. But if they have severe trauma or like early childhood trauma, and if they have other disorders such as bipolar illness or other disorders, they need more, and they need guidance, and they need to be instructed in all the things that are necessary to do. And this is the work I do. I teach them, I practice it with them. It's really not like a difficult thing. It's just, it needs to be done. It's like doing push-ups. It's not about knowing how they're done. It's about doing them. And it's the same with this. It's simple things to do. Breathing exercises and a little prayer in the morning, and then a little gratitude list. I mean, these are sweet little tools. It's not a hard thing to do. But people must understand that this is what creates, as Eric explained so nicely, the new road in the brain. Mm-hmm. And if that doesn't happen, and then they go to a lot of meetings for a few days, and then they quit it, and then the next thing you know, something happens that upsets them, and then they get loaded, and then they don't show up for the court date, or for the custody hearing, or for the IRS thing, because it freaks them out, and they avoid it, and that's just too bad. And so this is why what needs to happen is people need to have like a protective little place for a while. There is research that shows that 90 days is like a magical time frame to change habits. And so I'm going to say if people go to treatment for 30 days, it's not bad. 90 days is a lot better, half a year better, and the outcome shows that. Of course, some people don't go to treatment and they just go to AA, and some people can do that, but the chances are minimal. So it's really a behavioral program that needs to be implemented, like a little ritual every morning, and a way of establishing a relationship with oneself, and to understand that it's not anybody's fault, because there is such shame associated with this, and such guilt to where people think, you don't know how bad I really am, you don't know what I've done. And when people feel so ashamed of themselves and so guilty about what they've done, they often don't think they deserve recovery. And then they self-sabotage it, and there goes the Thanatos side with the destruction. So I'm gonna end with this. I don't underestimate the self-destructive tendency of an addict, because they're brutal with themselves. And this is what needs to happen on a daily basis with support. And then people have a chance. I had that chance. Apparently Eric did too, and some of you did too. So thank you.
Okay. And a lot more research has been done on women who have been traumatized than on men. Why do you think? They're more likely to ask for help, yes. They're more likely to report. Women are more likely to report or ask for help. Because we're taught when we're little girls that it's okay to ask for help, right? It's okay to be upset, it's okay to cry, It's okay to have lots of different feelings. What are boys taught?
Man up.
You gotta man up, yeah, even when you're 4 years old. So, and the culture doesn't accept feelings from guys the same as from women. So that really cuts down the reporting by men. But it is increasing now, and so that more men are getting treatment than previously did. So I'm not going to go over all the symptoms, I'm just going to mention a few because I know all of you worked with PTSD, I'm sure. And but you know, one thing about trauma is whether it's physical, sexual, emotional, or neglect, there's sort of a core of symptoms that are the same. What are they?
Intrusive thoughts.
Intrusive thoughts, yes. Re-experiencing, flashbacks, numbing. Certainly they wind up with anxiety, depression, usually low self-esteem, lack of trust, fear of intimacy.
Getting easily started.
We're all supposed to be vigilant, right? And we tend to be vigilant. We're taught this to be safe in our culture, or any culture. But people who've been abused as children particularly, or even shortly after when adults are abused, they're hypervigilant. I know that I work a lot with survivors of childhood trauma, and they know everybody that's in the room, they know where all the exits are, they don't like anything blocking the exits. And I've had patients that couldn't sleep in their beds. They could only sleep on the couch. Why? Yeah, nobody could come up from behind them. I mean, I know sometimes couches are in different places, but most of the time, traditionally, they're kind of against walls. And so nobody could come up behind them. So I had a very simple intervention that it took me a long time to figure out. And I started telling my patients, put your bed against the wall. Great intervention. It really helped a lot of people. Now, they don't teach us that in school, right? Okay, so, and many of the after effects are similar in both men and women. There's certainly fear, anger, besides the ones I just mentioned. Sometimes there are eating disorders. Certainly addiction, right? I got into addiction I got into everything sort of accidentally. I was a professor of nursing in my former life, and when I first started my practice, I got a lot of referrals of women in the helping professions. So guess what I got a lot of? Survivors of childhood trauma. And if you get a lot of survivors of childhood trauma, guess what you get a lot of?
Addiction.
Addicts. Right. And if you get a lot of addicts, that's how I got my third specialty. Get a lot of people with bipolar disorder. So those are my three specialties that I got into accidentally. But which I love. Been doing it for 30 years plus, and I just love to come to work every day. Yeah.
Does the addiction cause the bipolar disorder?
No. No, it's just that a lot
The
of people
bipolar
with
disorder comes first, but the molestation and the trauma provokes the bipolarism.
Yeah, just like a lot of people might be addicts, but if they've never had a drink or never had another kind of drug, we wouldn't even know they were addicts because it doesn't show. Well, sometimes bipolar doesn't show for a while, and then something triggers it. Well, bipolar is a biological disorder.
So they're not born bipolar.
They are born bipolar.
They are born bipolar.
They are born bipolar, but different things cause the expression of the bipolar disorder. So trauma can, addiction can.
Okay.
And also, anyone who has anything that they're trying to self-medicate. People with bipolar disorder try to self-medicate. People with addiction try to self-medicate. I tell my patients all the time, the hardest damn thing to learn when you're clean and sober is to sit with your uncomfortable feelings. Because you've been anesthetizing it for a long time and never got the experience. And of course, when you have this trauma that affects trust and intimacy, certainly affects relationships, right? And I also tell a lot of people that were traumatized as children, it's like they get this V on their forehead. and it stands for victim. And all perpetrators recognize it, and they keep getting re-victimized. So they really need to change that to a V for victory. And they can do that. And people will say, what about that saying, time heals all wounds? If I wait long enough, will it go away? I said, well, in my many years' experience, I have found that time and a hell of a lot of hard work heals most wounds. But it really, people have to be willing to do the work. And you know that, people have to be willing to stay in recovery if they're going to not relapse. And for years I argued with the chemical dependency people who said, you can't treat trauma, it's going to be a trigger for relapse. And I kept saying, if you don't treat trauma, it's going to be a trigger for relapse. Well, now that everybody, just about everybody agrees with me. But I guess I was ahead of my time. And of course, you have to treat trauma with discretion, you have to have some experience, you have to have some training, because if you try to treat too much too fast, what are you going to do to the patient?
Re-traumatize.
Re-traumatize them and decompensate them. Right. So it's like I think treating trauma is like a balancing act. One second. It's like treating the trauma as it comes up, never trying to force feelings or never trying to force memories, and then keeping the person as functional as possible. So it's kind of like this. Yes.
Decompensate. I never heard that term before.
Okay. Decompensate means that they get a lot worse. Their anxiety gets worse, their depression gets worse.
If they've been triggered by or re-traumatized.
Yeah. Yeah, and that brings up, thank you for the question, because if a person is traumatized in childhood and then they're traumatized again in adulthood, that trauma is worse than someone who was never traumatized. I tell people all the time, fortunately I was not traumatized in childhood. So if I were raped, it would be horrible and I'd go to therapy, but probably in 3 or 4 months, I'd recover from it unless it had been, particularly horrendous beating up or something. Whereas if someone was traumatized sexually, particularly as a child, and then they're raped as an adult or as an adolescent, it takes them much longer, much longer. And one of the things that's really helpful today is we're treating children. Years ago, we have all these adult survivors because nobody thought that people went to psychologists or psychiatrists unless they were crazy. I remember my mom went through a depression when she went through the menopause, and so I was trying to convince her to go see a psychiatrist. And I talked to her for hours, and she said, "Are you telling me I'm crazy?" And that was the old attitude about it, And I could say, "No, I'm not telling you you're crazy because you're not crazy. You're depressed, but you need help." So she finally went. But at first she was like a lot of people are, kind of insulted. So a lot of people wind up going for treatment for addiction, and then they get into treating their trauma. Sometimes it's the other way around, but a lot of times people wind up going for their addiction, going to rehab, then coming to someplace like Sovereign after that, and it's really important to treat both. It's really important to treat. And in fact, we still say dual diagnosis, but the more appropriate term is co-occurring disorders, because most people nowadays have more than two. So, and when someone goes for therapy, it's important for them to go to someone that has some training in addiction and in trauma. Because just because someone is an LCSW, an MFT, a psychologist, or a psychiatrist, and they're good, not that they're not good therapists, but if they don't have any training in addiction or trauma, they're not going to be good for the person who needs to recover from that. So getting people to come for treatment is the first goal for both their addiction and their trauma. And the thing that we use here that I like very much is the first book that I know of that was written for both.
The signal goes back to the hypothalamus. The hypothalamus sends out a signal to the pituitary. The pituitary sends out a signal to the adrenals, and now you're in full alert. Okay? You're going to fight or run. So you run around life like that. Everything is either fight or run. So if you're avoidant, you become hypervigilant. If your avoidance is your preferred learned defense system, then you become hypervigilant, looking for threats that need to be avoided, and you see few opportunities. Your world becomes limited by this. If you are aggressive, then everything becomes a thing that needs to be attacked. You're verbally aggressive, you can't have a conversation. Every conversation is an argument. Everything is a competition. And so you perform. Now, that's the simplistic, basic model of how trauma over time results in the things that Dr. Carlson was just discussing. What's the solution? How do you undo that? Anybody got any ideas?
You mean how to sort of get beyond the negative, just how to build a new way of
Create new pathways.
Yes.
right.
So
there has to be an incentive and sort of there almost has to be proof, doesn't there? A paradigm of success, I think. Set
well, you have to believe that you can achieve change.
Faith then, right.
You can't change if you don't believe that you can achieve change. If you just know things, if you just talk about things, and we discuss what your problems are, and we identify what your problems are you now going to be able to change?
Not necessarily.
You have to learn new behaviors in order to be able to change. Those new behaviors will gradually, through that same reward system, reinforce new tracks. If you don't take it in, if you don't add up a behavioral component to, I don't care what your theoretical model is for therapy. If you don't have a behavioral component as part of it, then you're not going to get the change that you would like to see.
My husband was raised in poverty, and that was traumatic for him. And he would tell me a story that sometimes all they had was a box of cereal, and they would use water for it, which I went in the room and started crying because I assumed every little kid had milk that lived in California. And so when we got married, we'd always have Sunday dinner after church. And so my mother would cook smothered chicken. My mother was a really good cook, and so some of the food was on the stove. And when he would put his plate away, he'd go by the stove and he'd just eat. And I was like, why are you doing that? You know, this is before it clicked for me. And my mother said, Greg, she goes, it'll be there when you get back. You can take some home. And he kept doing it until he finally, in his own mind, I don't have to do this. There's food is going to be here. I'm not a kid anymore where I didn't have, he literally had to work through that it's okay, I don't have to, the food is going to be there, I have enough. And he did that for like 2 years, first 2 years of my marriage. Like he didn't think there was going to be any food left because it took him back immediately to like, when his mother would bring apples, they'd jump on the apples like animals and hide it because they knew that if we didn't do that, the older kids would eat all the apples.
Do you know why that is?
It was just like you said, it was just imprinted on his brain
Right.
that there, hunger.
But he intellectually knew, even from the very beginning, that it wasn't like that. But because of the way the limbic system works, because of the way the amygdala works, it short circuits, because it's faster, it short circuits the ability to be able to stop and think. So you're in response immediately. And it doesn't, when we talk about triggers are like the most obvious things. But your memory is encoded in such a way that the experiences that you experience are multi-connected to various other things, and sometimes in sequential and in non-sequential ways. So ordinary stimuli can trigger you. So you can, if you don't have a program to deal with recognizing that you're being stimulated and self-soothing, then you are not going to be able to understand why these things keep happening. But it's because it's not a simple pattern. It's not a straight, direct line. It's like a spider web. So all these things are constantly in your consciousness, coming into through the thalamus, sensory information, and they're constantly being routed to portions of your brain, and sequences start automatic. Automated sequences start. And the next thing you know, you're in the middle of a behavior. So that's the explanation for the physiologic explanation for why stuff happens. Yes.
At an appropriate time, I'd like you to talk about the old brain and the new brain. I'm very intrigued by that, and I don't know enough about the brain as much as you do, but I'd like to hear your thoughts on that and how it can affect people, especially those in
That's what we're
especially
talking
addicts.
about. The limbic system is the old brain.
Thank you, because I
Okay.
need to hear.
The limbic system is the old brain. The neocortex is the part that got added onto it.
Thank you.
Nothing below birds have a neocortex. All animals that are less evolved than birds are without it. They're just stuck with the limbic system, which they have no sense of self. Reptiles have no pecking order. Birds have pecking order. They have a sense of self. They know their place.
Because of the neocortex?
Yes.
Okay.
So that's what that adds a better evaluation of threat and opportunity, increasing the chance for survival. So that's.
Can I ask something?
Sure.
So when you say new behaviors, does that entail like relaxation and mindfulness, or is it like
I'm gonna let Jasmine talk about things like that. But when I say new behaviors, I mean whatever is appropriate to the changes that you want to make. So it takes a discovery process. It takes a planning process, and it takes an implementation in stages. And it takes a willingness to accept failure. Because nothing happens. You know, I mean, did we start walking? How many times did we stumble and fall and wobble learning to walk? So when you've got a whole impetus to do something that you're trying to redirect, you're not going to be able to redirect it with skill from the beginning at all. And sometimes you just won't even be able to redirect. That was the quandary. You know, I stopped using drugs. Why was I having these problems in my life? Why was I making all these bad other choices? You know? And it's just that simple. So that's about as far as I'm going to go in this discussion. If there's any other questions, please ask. Yes.
I just want to say thank you. I'm sober myself, and I've heard many times over the years, you can't think yourself into right action, but you can act yourself into right thinking. And it's cool to hear the sort of the evidence, the scientific foundation for that.
Yeah. We also say, I got 22 years in Narcotics Anonymous. We also say that your disease keeps growing. Okay.
It's progressive, right?
Yes. And even when you think you're in recovery, it never sleeps.
Mm-hmm.
And that's the neurological reason for why.
Right.
Those connections are so interconnected with other things that if you stop the recovery behavior,
Right.
you know, I said I wasn't going to talk about addiction,
But that's why, I'm sorry, but that's why you keep building those pathways.
Yeah.
You keep grooving that new,
Yep.
right.
it's a neurophysiological fact. So thank you.